What's up, everybody? Happy Mindfulness Monday. Yes, it is Monday. It is our favorite day of the week. As many of you know, we are in the business of changing paradigms, not only in health, not only in healing, not only in the culture, but our mindset, especially when it comes to starting a new week. And I would hope that if you tune in with me on a regular basis on Mindfulness Monday, that you look forward to this. I really want to make these Mindfulness Mondays something that you can look forward to shift your energy, to shift your mindset, and to shift your perspective. Today, we are going to be talking about informed consent in all ways, not just in a medical paradigm, but informed consent and understanding what is available to you and knowing that you, through informed consent, get to and are allowed and should be given consent from a risk perspective and a benefit perspective. Now, I was inspired to come on here and share with you about this topic. Again, whether you're tuning in on Mindfulness Monday Live, or if you're watching later today, later this week, or you're listening on YouTube or a podcast. I was really inspired to come on here because I've been working with quite a few people, quite a few women, where they have had experiences at their doctor's office, and not necessarily just a medical provider, but any form of doctor, such as myself. They have had experiences where they were not given the full story, or they felt as though they were led in one direction and didn't have alternate options. They felt as though they didn't have choice and they didn't have informed consent. And to me, this is something that if you work with me or you're a new practice member, this is something that we go over right away. I talk about what's available to you. I talk about, what have you tried? What other things have you considered? Have you tried chiropractic? What has your medical doctor said? Are you aware of the risks of that? Are you aware of the benefits of that? This is something that is very important to me and part of my responsibility. And my oath as a doctor is to do no harm first, always putting the practice member and the patient first. And in fact, I don't even use the word patient because patient denotes suffering, and that there's a hierarchy and a superiority complex within the doctor-patient relationship, meaning that a patient is one who suffers and a doctor is someone who maybe has more authority or just knows better, when in fact, to me, a practice member is someone who practices health and is in partnership with the practitioner, where we are on equal playing ground, where we are in this relationship together and we are exploring options of healing together. So if you ever hear me say practice member, it's an evolved term from the word patient, and it has a lot of meaning. And being a practice member means that you take responsibility for your own health. And part of taking responsibility is that you ask questions. Listen, I don't know about you, but if you've ever been in a situation with a doctor, maybe you've given birth, maybe you've gone into a doctor's office where you felt like you didn't know all of the truth, you're not alone. This has been happening more often than I'd like to admit to, but it's been happening more often that I've seen within my practice members and people, specifically birth, specifically women who want to maybe shift up the way that they're dealing with their menstrual cycles. And one of the things you must know about informed consent is that it implies the exploration. Hi, Eunice. So informed consent implies the exploration and confirmed awareness of all known risks, benefits, and alternatives. I'll read that again. Informed consent implies the exploration and confirmed awareness, meaning that you are confirming that you are aware of all known risks as far as the procedure you're taking on, benefits, and alternatives that exist. Now, not many of us went through a doctoral program, but one of the things, and it's kind of funny, they don't realize that chiropractic school is medical school. We take classes in gastrointestinal health and men's health and women's health and mental health and PT and physiotherapy and nutrition in all ranges of health care. Because as a doctor, it is important for me to know what you've tried, what you've done, what hasn't helped, and maybe other things that you're not aware of within different health paradigms, and to make sure that I guide you in the appropriate direction, not for my benefit, but for your benefit. Because listen, if you don't realize that there's a PT out there who could help you, it's my job to let you know what exists out there. Now, if I don't disclose that, that's on me. And that's actually not taking all informed consent into consideration. Again, knowing all risks, benefits, and alternatives. This is why throughout the course of care, I will ask people, what else have you tried? I know how to stay in my lane as a chiropractor. I know what I do and I know what I don't do. And I think that's why we get such great results. But I also need to be aware of what else exists out there. And there's a point to this, I promise, but I want to let you know that informed consent is, you're not just consenting to the benefits that you may gain from something, but you're also consenting to the risks. And that includes long-term risks. For example, I don't know how many of you ask, but if you've ever had surgery or if you take medication, I implore you to ask, listen, doctor, I understand that these are but the potential benefits of masking a symptom with this medication, but what are the risks? What are the long-term risks of taking this medication? Ask your doctors this. You as a patient, you as a practice member, that is part of working with someone, is understanding not only the benefits of something, but the risks. What are the risks in taking a medication long-term? This is something that I don't feel doctors in the medical field talk about. What are the long-term risks of using a specific medication, an IUD? This is big right now in our office. A lot of women are starting to look at different alternatives to birth control, but asking, listen, what are the effects on my hormones? What are the effects? Doctors sometimes aren't educated on the long-term effects of something. And that is something that I pride myself on, is understanding physiology. Now, I can't tell you what medications to take or not to take, but it's my job to say, hey, are you aware of the long-term risks and outcomes of this surgery, of this medication? It doesn't mean that you can't take it, but I just want you to know that when you take something for so long, your body builds up a tolerance, and ultimately, I'm specifically speaking to mental health medication, sometimes the very thing that you're trying to avoid when it comes to taking this actually starts to become the problem and get worse over time. And doctors in the medical field or psychiatry aren't always educated on the long-term effects because their goal is to try to reduce symptomatology. And I've been reading this book and I want to share this with you, that sometimes we must know what's really possible in order to make a choice that feels empowering to you. And what I hear in that is, yes, medication is one thing, yes, surgery is one thing, but there are so many other options and ways of operating when it comes to your health that sometimes I don't think you know are available to you. And in this book, she talks about that when we mask symptomatology and when we mask symptoms, we lose the opportunity to understand why our body was symptomatic in the first place. Your body is intelligent, your body is brilliant, and symptoms are a way that your body is getting you to pay attention. So if we just mask that with things, whether it's numbing out through medication, alcohol, and other forms of numbing out, we lose out on the opportunity to actually understand why our body and what our body is saying in the first place. And I just thought that was brilliant, that we must know what's really possible in order to make a choice of informed consent that is empowering to us. Meaning, not many people understand that changing up your lifestyle habits and changing up your ways of thinking, your ways of being, whether it's movement, chiropractic, acupuncture, meditation, sleeping, what you put in your body, breath work, not many people understand that those are also options. So I want to share with you 3 different points to really help you understand the journey of informed consent and feeling empowered in your health choices. Again, because not only is it the benefits that doctors will say, well, these are the benefits of this medication, or even in chiropractic, these are the benefits of chiropractic. But you also need to understand long-term benefits and long-term risks. It's like anything. Before I get into these 3 points, it's like anything. If you take something for so long, your body's intelligent and it builds up a tolerance. It's the same thing. You drink 1 glass of wine a night, you're gonna need more wine to feel the effects. Medication is no different. That's why they need to do checkups and say, oh, we need to boost your dosage, or we need to change this. Medication is no different. And this is me not bashing medicine, but I really invite you to look at the whole spectrum of informed consent. It's not just about the risks. It's not just about the benefits. It's about the risks and alternatives. And if your doctor is a well-versed doctor and they understand informed consent, these are some things that you can ask them to take a stand for yourself on this journey. So number 1 is ask. Use your voice. Ask your doctor, listen, this is what I'm dealing with. What other options are available? What if I don't want to take medication the rest of my life and be dependent on that? Because I promise you, your anxiety is not caused by a lack of anxiety medication. Ask them, okay, I understand that medication is one thing. What are some other options available to me? What are some other forms of health and healing that I can tap into on my own? Do you know any other practitioners that maybe deal with holistic healing from a mental health perspective? Don't be afraid to ask. And if your doctor doesn't know, then maybe it's time for a new doctor. Because I will have people ask me, say, okay, I understand these are the benefits of chiropractic that you've seen. What are some other things I can do on my own? And I will share with them. You can do breathwork, you can do movement, you can do meditation, you can change your diet. These are all different things that I believe as doctors really need to look at. You need to look at the whole person. You need to look at all their choices and not just say, well, you can take this medication or just deal with it the rest of your life. That doesn't fly in my house. So number 1 is ask. Do not be afraid to ask. Do not be afraid to use your voice. What other options are out there? What are the risks? I invite you. Number 2 is taking a stand in that. Taking a stand for yourself. Taking a stand in what you believe in, what you want to know to be true, what you desire to know to be true about your body and how it can heal. Don't be afraid to take a stand. So number 1, asking if there's other options. And number 2, taking a stand and say, you know what? To my core, I don't believe that, and I desire something different for my health. Don't be afraid to stand in your truth. It can be uncomfortable, and this is an email I actually wrote today. Don't be afraid to stand in what you believe in, even when other people around you aren't necessarily agreeing with you. Don't be afraid to take a stand. So number 1, ask about other options. Number 2, take a stand. I'll add to that, take a stand. Don't be afraid to also ask, what are the risks of doing this long term? Whether it's a doctor, a health professional, what are the risks of doing this long term? Side note, one of the things I share with people, I'm very upfront about how chiropractic works. I'm very upfront about the healing journey. And one of the things that I say to people is I say, look, you've never been adjusted. This is what you got going on in your body. I want you to know that sometimes it gets worse before it gets better. And some of you, comment below if you've experienced that in any form of detox or holistic healing. Sometimes the body has to go through this detox and let go of those patterns and things that aren't serving before the body gets better. So this can look like diarrhea, headaches, increased pain, trouble sleeping, or maybe sleeping a lot. I am not shy to say, look, you're going to go on a journey and sometimes it's going to be uncomfortable, but I'm with you every step of the way, okay? I'm not afraid to be in the discomfort with y'all. So 1, ask options, risks. 2, take a stand for yourself. Find what you believe in. And number 3, this is important for all you people pleasers out there, it is okay to say no. It is okay to say no. You don't need a reason. You don't need to explain yourself. And you don't need to apologize. Informed consent means you are consenting to a yes, or when you read everything that's involved, with the risks, the benefits, and the alternatives, it's okay to pause and say no. It's okay to say no. And this can be hard in a culture where we like to please people, we like to make other people happy, we like to make sure everything is okay and everyone's okay and we don't hurt anyone's feelings. Listen, if you say no to your doctor and they get all weird about it, that's their personal stuff coming up, okay? I have had many people explore the options of chiropractic care, the version of care that I offer, and it's just not the right time. And that is okay. That is okay. I don't take it personally. Do I feel as though everyone would benefit from this care? Of course I do, because I've seen it change so many lives. So many lives. Like profound, magical healing. But it takes commitment. It takes an investment in yourself. It takes courage. And just because you say no does not mean you're courageous. It's just not the right time. And that's okay. I'm here when you're ready. So to back up, remember, informed consent implies the exploration and confirmed awareness of all known risks, benefits, and alternatives. And we must know what's really possible, what else is out there, in order to make a choice that feels fully empowering. Because when you know other options that are available, it feels empowering, right? It feels like you have this opened up array of choices. It'd be like going to an ice cream shop and only seeing that they had vanilla. And it's an ice cream shop, right? So you're like, oh, they got all these flavors, right? They specialize in ice cream. But yet all they have is vanilla. And you're like, really? That's all you got? You don't have like peppermint bonbon, strawberry banana, chocolate. You just got vanilla? You intuitively know that there's other options out there, right? So go into your appointments with that perspective and don't be afraid to ask. So number 1, ask if there's other options for these points. 2, take a stand for yourself. And 3, it is okay to say no. I love you all. Thank you for tuning in. I hope this serves you. I really invite you, if this is serving you, if these Mindfulness Mondays are serving you, comment below what you're getting out of it. If there's anything else you'd like me to cover, I have a list of things that when you join this group that I like to tune into and do lives about. But I appreciate you all tuning in. Listen, you are amazing, you are powerful, and you deserve to know the full truth and nothing but the truth. Thanks for tuning in. Peace, love, and keep inspiring.